and how we can address nutrition and some of the challenges that our clients with dementia face during mealtime. Just let's see. Sorry, I'm in trouble. Going to the next slide here. There we go. Okay, so just a quick acknowledgement to HRSA for their funding that helps support this presentation. Okay, so today we're going to be talking about the role of nutrition in brain health and how that impacts cognitive function and the prevention of dementia. We'll talk about some of the dietary patterns and specific nutrients that really support brain health. And then we'll talk about some practical strategies that we can use to address some of those challenges at mealtime and make sure that individuals with dementia are getting optimal nutrition. Okay, so let's start with the basics. How does diet influence brain health? What we eat impacts how we think, how we remember, how we age. And research shows that there are certain dietary patterns like the Mediterranean and the MIND diets that are really associated with slower cognitive decline and lower risk of Alzheimer's disease. So these diets emphasize whole foods, which we'll talk a little bit more about, but specific things like leafy greens, berries, fish, nuts, and olive oil. And then they limit the processed foods and added sugars. And then those specific nutrients like omega-3 fatty acids help maintain the structure of brain cells. Antioxidants protect against oxidative damage, and then B vitamins support neural function. So we'll talk about each of those. But as healthcare workers and those who interact with older adults, understanding this connection really allows us to educate these patients or clients on how their everyday food choices can promote cognitive function and cognitive longevity. I want to talk about the link between nutrition, inflammation, and neurodegeneration as well. So chronic inflammation is a key factor in the development of many chronic diseases, including Alzheimer's disease. So those diets high in refined carbs, added sugars, and saturated fats can trigger this inflammation and then potentially damaging brain cells and accelerating neurodegeneration. On the other hand, diets that are rich in anti-inflammatory foods like vegetables and fruits and omega-3s can help reduce this process. So nutritional strategies that focus on reducing inflammation are not just preventative, but they may even slow the progression in those with early symptoms of dementia. And then I want to talk about the gut-brain axis. So you can see that gut-brain axis in this picture here. And it's a powerful two-way communication system. So it's connected by the vagus nerve. You have immune signaling, neurotransmitters. In fact, your gut microbiota, so the organisms in your gut, produce key chemicals like serotonin and dopamine, those feel-good hormones, right? Which really impact mood and cognition. So when that gut microbiome becomes imbalanced, it can lead to chronic inflammation, increased gut permeability, leaky gut, and neuroinflammation. So research has shown that Alzheimer's symptoms can be transferred to healthy animals by transplanting that gut microbiota from people with Alzheimer's disease. So this is suggesting a causal role for the gut microbiome in the development of Alzheimer's, which I think is really fascinating. This quote, often attributed to Hippocrates, reminds us of a truth that modern science is now really rediscovering, and that's the food that we eat has a profound impact on our health, especially our brain health. Our brain is a highly active organ. It has high metabolic demands. So it's really impacted by what we the energy that we consume. So every bite that we take is either fighting disease or it's feeding it. And when it comes to preserving memory and focus and cognitive function as we age, nutrition is one of the most powerful tools that we have. So today we're going to talk about the evidence behind those specific dietary patterns that protect and nourish our brain, and really truly allowing food to be our medicine. So we're going to start with the diets that are strongly associated with cognitive preservation and reduced dementia risk. These dietary patterns, they really emphasize nutrient-dense, whole foods that protect the brain and support neurological function. So one of the most well-studied examples that we have is the Mediterranean diet. And it's based on traditional eating patterns in countries like Greece and Italy. And it focuses on whole plant-based foods and healthy fats, especially from extra virgin olive oil, nuts, and fatty fish. It's also rich in polyphenols and omega-3 fatty acids, both of which have those neuroprotective effects. So polyphenols, they reduce oxidative stress and inflammation, while omega-3s support, like I mentioned, the healthy brain cell membranes, and they improve blood flow. So there's a landmark study, the PREDIMED study, and it showed that individuals following a Mediterranean diet had significantly better cognitive outcomes over time. So this shows us that it's not just about the foods that you avoid, like sugar and processed foods, but it's also what you include in your diet that helps support the aging brain. The next diet we're going to talk about or dietary pattern, I'll say, is the Mediterranean DASH intervention for neurodegenerative delay, or the MIND diet. And so this diet integrates components from both the Mediterranean diet and the DASH diets, both of which have shown evidence that they help with cognitive function. And the MIND diet was crafted with the specific aim of promoting neuroprotection and preventing dementia. So this diet recommends increasing our plant-based foods, particularly berries and green leafy vegetables, and I'll tell you why in a moment, and then limiting the red meats, pastries, sweets, dairy, and fast-fried foods. So there's a longitudinal study that was conducted in Australia, and it revealed some findings regarding the MIND diet's efficacy. So it showed that high adherence to the diet demonstrated 53% reduction in the risk of Alzheimer's disease. And even moderate compliance with the diet yielded a 35% decrease in risk. So this shows us that even taking small steps towards a specific goal of eating healthy can make a really big difference. And I think that that's important for us to share with our clients as well. So let's look at the foods that this MIND diet recommends increasing on the left and then decreasing on the right side. So on the left, we want to increase those leafy green vegetables. So that's things like spinach and kale. They possess the most potent neuroprotective qualities. They're rich in sources of lutein, folate, vitamin E, beta carotene, and polyphenols, which are all nutrients that are related to brain health. And then berries are packed with antioxidants, particularly flavonoids, which have been linked to improved brain function and also to reduce risk of age-related cognitive decline. Then we have fatty fish. So these are things like salmon and trout and sardines. They are rich in omega-3 fatty acids, particularly EPA and DHA, which are both really essential for brain health. And then incorporating herbs and spices like turmeric, cinnamon, rosemary, oregano, incorporating these into your meals not only adds flavor, but it also provides additional antioxidants and anti-inflammatory compounds that can benefit the brain. So on the right side, looking at those foods that the MIND diet suggests decreasing is butter and margarine. So these are sources of saturated fat and trans fat, which should be limited as they've been linked to inflammation and an increased risk of cognitive impairment. Then cheese. So while cheese or while dairy can be a healthy or be part of a healthy diet, high-fat cheeses should be consumed in moderation due to their saturated fat content as well. And then looking at sweets and pastries. So foods that are high in added sugars or candy, cakes, cookies, pastries, they should be limited in the MIND diet. So high sugar intake has been associated with cognitive decline and an increased risk of dementia. Fried foods are typically high in unhealthy fats, and they also can contain some harmful compounds that are formed during the frying process. So limiting intake of these foods can reduce inflammation. And then processed foods. So we're talking fast food, frozen meals, even some of the healthy frozen meals, packaged snacks. They often contain a high level of unhealthy fats, a lot of sodium and added sugars. So they should be limited in this diet in favor of whole, minimally processed foods. All right, and as I mentioned, certain nutrients play a significant role in cognitive function and can reduce the risk of neurodegenerative diseases. So the first one that we're going to be talking about is the omega-3 fatty acids. So these are critical building blocks of the brain, particularly DHA, which supports brain cell membranes, and synaptic plasticity. And this is the ability of neurons to connect and to adapt. You may have heard it as neuroplasticity. So these fats are found in our oily fish. You can mention salmon, sardines, but it's also found in plant-based sources like flaxseed and walnuts. So studies show us that omega-3s can reduce neural inflammation and are linked to better memory and cognitive performance. Okay, let's now talk about some of the brain's most powerful defenders. So these are our antioxidants and polyphenols. So as we age, our brain cells face daily threats from what's called oxidative stress. And this happens when harmful molecules called free radicals build up in the body, and then they start to damage our cells, including those in our brain, of course. So this damage is thought to play a role in aging and also to neurodegenerative diseases like Alzheimer's. So antioxidants are substances found in a lot of different fruits, vegetables, and teas. And they help neutralize those free radicals and protect the cells from that damage. Now, polyphenols are a group of antioxidant compounds that are found in plant foods, and they help fight inflammation and they protect blood vessels as well, including those in the brain. And then within this group are the flavonoids, and these are a specific type of polyphenol found in berries, dark chocolate, and green tea. And they've been linked to slower rates of cognitive decline and better memory. And so these different nutrients are found in different colors of plants and vegetables, or fruits and vegetables. So when we say to eat the rainbow, it's not just because it looks pretty. It's to load up on those different brain protective compounds that help our minds stay sharp. And different ones are found in different colors. And this is just a resource that I like to share. You can find this in the references if you want to access a PDF of it. But this is just a way that I like to kind of eat the rainbow and get a lot of different nutrients that my body needs. And this is just finding different things with the different nutrients and kind of different takes on it, called Nourish Bowl. And it's a simple way to get a lot of different nutrients in one meal. So as I mentioned, the brain is a highly metabolic organ. It needs a steady supply of energy, and whole grains are really a perfect source for that. Unlike our refined grains, the processed grains, these provide a slow release of glucose, which fuels the brain, but without having those spikes and crashes. So they're also packed with fiber and a lot of different nutrients that support our brain health and our gut health. So these include things like oats, quinoa, brown rice. Simple, powerful way to get in some good nutrients. Next are our B vitamins, especially B6, B12, and folate. These vitamins are really essential for brain function. They help produce those key neurotransmitters like serotonin and dopamine, and they lower our homocysteine levels, which are associated with brain atrophy and dementia risk. And it's important to note that if you have someone who is following more of a plant-based diet and having less animal foods in their diet, it's important to monitor those B vitamin levels, especially B12, since it's mainly found in animal products. So sometimes someone might need supplementation or to eat some or drink some products that are fortified with B vitamins. Our healthy fats, which include our monounsaturated and polyunsaturated fats, help with the brain cell membranes and reduce inflammation. And these can be found in olive oil, avocados, nuts. And these are key components of our brain-friendly diets, like the Mediterranean diet. Next is vitamin K, and this isn't usually the first nutrient that we think of when we're talking about brain health, but research is really starting to uncover its potential in supporting memory and cognition. So this is found abundantly in dark leafy greens, like our spinach and our kale. And the vitamin K is involved in brain cell signaling, and so it may help protect against age-related cognitive decline. So yet another reason for us to include those greens on our plate every day. Now, I talked about the gut-brain axis, and a lot of these foods are good for general brain health, but I wanted to point out the specific things that can help with gut health, since we know that our gut and our brain are linked so closely in that gut-brain axis. So fiber-rich foods, which fiber is found in fruits, vegetables, legumes, whole grains, are fermented foods, so things like yogurt, kefir, um, sauerkraut, and then our polyphenol-rich foods are antioxidants in berries, olive oil, green teas, herbal teas, and then limiting those ultra-processed foods, added sugar, and then artificial sweeteners can mess with the gut microbiota as well. So just specific to the gut-brain axis there. Okay, so working with older adults, we're in a unique position to be able to guide them and their caregivers in making nutrition a key part of dementia care. So by offering support around meal planning, around food selection, ensuring that they are getting adequate nutrient intake, we can make the brain healthy eating more achievable and also sustainable, even when we're looking at some of the common challenges. So we're going to be talking through how we can do that. So first, we can encourage them to base their meals on the Mediterranean and MIND diet principles. So we know that these dietary patterns are backed by strong research for cognitive preservation. So giving them a structure, a framework for how to eat can be helpful for them. And then highlighting those foods that are rich in omega-3 fatty acids and suggesting antioxidant dense options can really help them fight the oxidative stress in their brain. And then nutritional counseling can have a major impact. So we know from studies that most healthcare providers do not feel confident in their nutritional counseling abilities because they don't receive a lot of education on it. So education is a key part of this and learning more about nutrition. But some of the key things specific to cognitive health that we can incorporate in nutritional counseling is monitoring those key vitamins like the B vitamins to reduce homocysteine levels that are associated with cognitive decline. And then education around choosing healthy fats like olive oil and nuts. A lot of people are afraid of fats, and so they'll even stay away from those healthy fats that are good for the brain. So teaching them that there are good fats and then using those instead of those saturated fats or the bad fats so that they're supporting brain function. And just as importantly, we have to identify early any barriers for implementing these changes, whether it's cost, access, or cooking skills. And we'll talk about that more. Another thing to consider is simplifying meal preparation. It's really key. So especially when working with caregivers and older adults that are managing cognitive decline, right? So focusing on teaching easy techniques like prepping overnight oats or making simple salads can help them be sure that they're making healthy choices, but easier for them. And then snacks that are rich in polyphenols and healthy fats. So, a handful of walnuts with some blueberries. They offer some powerful brain support without a bunch of complex recipes. I also recommend using some educational videos to reinforce these concepts visually. So I've included a link to a good one there for you. All right, so many older adults face significant barriers to eating well, including food insecurity, limited mobility, financial constraints. So, some strategies that we can incorporate to address some of these barriers include recommending shelf-stable, nutritious foods like canned beans, whole grain pasta, fortified plant milks with B vitamins and D vitamins and calcium. That can be helpful. And then helping them find grocery services that accept SNAP benefits can improve access. And then teaching about affordable nutrient dense foods like beans and frozen vegetables makes a big difference. So our frozen vegetables maintain their nutrients very well. So canned foods, a lot of canned vegetables, a lot of times will have added sodium and lose a bit of their nutrition quality. So, encouraging those frozen vegetables can make a big difference in the nutrients that they take in. And then resources like the ACLM's Eating on a Budget handout can offer some practical guidance on some of those low-cost foods that are high in nutrients and some great recipes for those ingredients. And then connecting our older adults and caregivers to some of the community programs can help them address some of those root causes of food insecurity. So programs like SNAP, Meals on Wheels, congregate meal services, and farmers market vouchers provide some of that financial and logistical support. And they ensure that nutritious, brain healthy foods are accessible even for those who have limited resources. So proactively offering these connections to these programs can really transform a person's nutritional status and their quality of life, of course. When we're working with individuals with dementia, I'm sure many of us know that the meal times can present a variety of challenges. So this can be from reduced appetite to confusion to difficulty chewing and swallowing. I like this graphic. So this is from the National Institute on Aging, and it offers us just 6 really practical tips to make those meal times smoother and more enjoyable for both the person with dementia and their caregiver. So first, trying to serve meals in a consistent place, a consistent way, a consistent time each day really helps to create a comforting routine. And then offering foods that are familiar and well-liked helps to reduce their anxiety and encourages better eating. And then using mealtime as an opportunity to connect socially by maybe talking about shared memories or, just some light, enjoyable topics. Also minimizing distractions. So turning off the TV or radio and then allowing the focus to really be on the meal and stay on the meal can be helpful. And then we need to make sure that the food is easy to eat. So whether that's cutting it into small pieces, ensuring that it's soft enough for safe chewing and swallowing is important as well. And then finally, serving one food item at a time and really avoiding rushing. Giving plenty of time for eating can reduce frustration and also promote independence, which is very important for that person. So small adjustments like these can really make a big difference in preserving their dignity and improving their nutrition and really creating a positive mealtime experience. Okay, let's meet Mr. James. So, Mr. James is 82 years old and he's living with moderate stage Alzheimer's disease. He lives at home with his daughter, who is his primary caregiver. And lately, his daughter has noticed several changes. So, Mr. James has a poor appetite. He often forgets to eat meals completely. And he gets really distracted during meal times, especially if the TV or other noise is on. He also has trouble chewing due to some dental issues, and he's lost about 10 pounds over the past 6 months. So I'd like for you to take a moment to think about what nutritional challenges stand out to you in Mr. James's story. And then what are some practical strategies that might help Mr. James and his daughter? And then I'd also like to think about, like for you to think about if you've faced any similar situations in your work or your caregiving experience. And if so, what solutions worked well for you? You can take a minute if you'd like. If you have any ideas, feel free to shout those out, or you can put those in the chat. I'll try to get my chat open here. Yeah, absolutely. Turning off the TV, getting rid of those distractions, addressing his denture issues, big with those meals. Yeah, soft food. Reminders or setting times for meal times can be helpful, and identifying some of his favorite foods. Yeah, getting some foods that are easy to chew. Yeah, getting him into the dentist, figure out what his dental needs are. Absolutely. Yeah, nutritional drinks. So there are a lot of nutritional drinks that are available, right? We do a lot of prescribing of Ensure or other nutritional drinks like that. It really is case by case. So these products are full of different additives and preservatives, very processed. Trying to find more whole food choices for them. Sometimes it is very hard, and there's no other options. Really looking at their quality and what they can take in. So it's kind of I don't know if that answers your question, but certainly trying to look more at those whole foods that are more nutritious is the best way to go about that. All right, offering foods that he likes, reminding him of meal times, increase fluids, encouraging the daughter to get help. Absolutely, so important. Quiet environment, sharing the meals with the daughter. Yeah, those social meals can be so helpful. Yes. Oh, that's a nice idea. Cooking the food in front of him so he can smell the aroma of the food. Financial problems, addressing that. Yeah, smaller healthy snacks throughout the day is really a great tip rather than those larger meals. Yeah, great job. Finger foods. Yeah, absolutely. Yeah, so and have any of you all faced any similar situations in your work or caregiving experience? Every day. Yeah, it's a challenge, right? Yeah, looking at are there any medications that are interfering with his taste or his appetite? Yeah, so a lot of you all experience this. Yeah. Okay, great. With your mother, she hides her food. Yeah. Okay, thank you all for sharing. Absolutely. All right. So as I mentioned, one of the problems with nutritional counseling is just that lack of knowledge and that lack of confidence in our abilities to do that counseling. So if you are looking for more education on this topic, there is a free course currently offered by the American College of Lifestyle Medicine. You can use this QR code to access this code, and it really has some great content on nutrition. So, highly recommend that. And you can get it free. Now, I think that that will end in like sometime in the fall, maybe September. So, if you're interested, check that out. The code is WHC22 at checkout to get that course for free. Pages of reference.